So good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we've had 582,348 confirmed cases, 6,952 new cases, 3,893 people are in the hospital, and sadly, we've crossed the 7,000 mark, and 7,076 people have died in North Carolina. We're sending our prayers to those who've lost loved ones to this virus and to the people who are fighting it now. We've turned the page on a new year, one that we're hoping will bring us better times. But as we know, this virus did not disappear at midnight on December 31st. In fact, in North Carolina, we've seen some of our highest case counts, percent positives, hospitalizations, and ICU bed usage numbers in the past few days. As Secretary Mandy Cohen will show, 96 counties are now labeled as red or orange, meaning critical or substantial virus spread. 96. No matter where you live, work, worship, or play, COVID-19 remains a deadly threat, and we've got to treat it that way. A new highly contagious strand of the virus has been detected in the United States, and we need to act as if it's already here in North Carolina. This should inspire every one of us to double down on safety precautions. Today, I'm extending for 3 weeks the modified stay-at-home order that requires people to be home between 10 p.m. and 5 a.m. Our other strong safety measures will remain in place, including the statewide mask mandate, closure of indoor bars, and limits on mass gatherings and retail establishment capacity. Dr. Cohen will also issue a new secretarial directive to caution in stark terms against leaving your home for any reason other than work, school, healthcare needs, or groceries. Remember, this virus spreads more when you're indoors, and especially if you take off your mask. Simply put, don't go places indoors where people aren't wearing masks. Deciding to stay home or say no to an invitation to get together indoors can be hard, especially with people that we know and trust. But it's necessary to save lives. As we work to prevent the spread of COVID-19, we're also helping local hospitals and health departments to support their vaccine efforts. Getting the vaccine out quickly is the most urgent priority right now, and we'll use everything and everyone needed to get the job done. Secretary Cohen and her department are doing an excellent job onboarding more vaccine providers and coordinating efforts to help prepare those providers to get their supply out efficiently. To support vaccine efforts, I've mobilized the North Carolina National Guard to coordinate with the Department of Health and Human Services and North Carolina Emergency Management. For now, this mobilization includes approximately 50 Guardsmen and women, and we'll add more as needed. Some can administer the vaccine. Others will support logistics, planning, and other key functions like helping local health departments and other providers make timely data entry into the state's tracking system. Today, we're concerned about reports that some people have declined to take the vaccine when it's their turn. However, as more people get vaccinated without any serious safety concerns, we believe that many of those who are hesitant will gain confidence. The COVID-19 vaccine is safe and effective. It was approved by an independent advisory board of health experts. It will eventually be our best medical weapon against this deadly pandemic. But as we said, it'll take many months to get there. Until then, we have to follow the data and use our best prevention tools to slow the rapid spread of this virus. Now I'm going to ask Dr. Cohen to share an update on our data and trends, as well as our vaccine rollout efforts.